Today we're going to talk about Mounjaro and 3 things you should know if you're considering taking it. So if you are thinking about taking Mounjaro, a few questions to ask yourself and consider before you start it. First one is this right for you? So Mounjaro is one of the newest medications for diabetes, but recently researchers released their most recent trial on Mounjaro. These were people who didn't have diabetes, and it showed excellent weight loss. So that's why there is so much buzz around Mounjaro right now and weight loss. Now, technically not FDA approved for weight loss. I'm sure that'll be coming soon. Who's it for, however? So people that were in the study were people who were overweight or obese, meaning they had a BMI over 30. And they had other risk factors. So those were the people in the trial. So what that means for you is if your BMI is 30, certainly consider it. Certainly if you have diabetes or risk factors, it could be a consideration. Now, another common thing that comes up around Mounjaro is the cost. Yes, it could be quite expensive, somewhere on the order of $1,100 per month, so or even more than that. So, you know, if you want to take it a year, you're looking at $20,000. Not cheap. What are some ways that we could possibly get it, or even something similar? So obviously if you have insurance and you have diabetes, there may be a way for you to get Mounjaro. Now insurance is typically not going to cover it unless you failed other medications for diabetes. Now that said, obviously that's a hurdle, but certainly insurance is one possible avenue. Mounjaro also does offer a assistance program right now. Typically, when drug companies come out with a newer medication, they will have some type of assistance to lower the cost dramatically. That would be something really to investigate, and they don't always hold you to the stringent criteria that an insurance company may. Now, those are probably the 2 easiest ways to make it more affordable. Other than that, it's going to be a little more challenging. There are some drug prescription companies like GoodRx or Hippo that can offer a discount if you don't have insurance, and you know that may cut the cost in half. Also looking at alternatives to Mounjaro, which semaglutide is probably the closest one in regards to how it works and the effectiveness of it. Semaglutide is typically covered by a lot of insurance companies right now, so that there's certainly another consideration, particularly for weight loss. Now, last but certainly not least, one of the things you want to consider is what happens when you stop. And this is going to be true of really any weight loss medication, not just Mounjaro, but what we often see is when people go off some type of medication, they regain some weight. Now, this recent study was looking specifically at weight gain after stopping semaglutide. The researchers reassessed the patients a year after stopping the medication, and a significant amount of people gained weight. And so, in fact, when they did the final analysis, they found that the people who had no intervention other than diet and exercise or lifestyle changes essentially had no weight loss at that 1 year later. The people who demonstrated significant loss and the other group who actually got the medication, they had about 11% weight loss overall. So the people who were in the study group who were getting the medication, they had a 5% weight loss at 1 year after stopping the medication. Taking this all together, these medications will help you get to a goal. However, it's still up to the person to maintain those results, and so you cannot go back to what you were doing before. Obviously that didn't work, and that's what we often see is people going back to what they were doing before they started their weight loss journey. This is even true of bariatric surgery or gastric bypass. I will say definitely surgical weight loss, they do get a more sustained result, but even those people will regain weight. And so about 25% of people who had a gastric bypass 10 years later will have regained all the weight they lost. Nothing thus far is going to be end-all magic bullet for anyone. And what's going to really matter is that you change your habits and lifestyles and address any underlying issues that may have caused the weight loss to begin with. I hope you found this helpful. Please share or subscribe.